Hi friends, I am Dr. Vikas Sharma, MD of Soul Physiotherapy Rehabilitation Center and Research Institute. Today I am here to performing spine, lumbar spine, flexion mobilization, lumbar spine extension mobilization and lumbar spine side bending mobilization. So performing the flexion, lumbar spine flexion mobilization to patients should be in side lying position, somewhat like this position, and first we taking the both leg from this technique. We are not using to this technique to hold both leg because it is quite difficult. We are taking like this both leg. Achha, before the holding both leg, first we palpate lumbar spinous process L4, L5 or L5, L4, L3, L2 and L1. It is essential to palpate L5, L4 and L3. So palpating the L5, L4 or L3, but we are seeing the line of iliac crest, and the iliac crest line, this is the gap between the L5 and L4, and this is the spinous process I am palpating. Spinous process of L4, this is the spinous process of L5, and switch the L4 spinous process. We are holding both leg and flex the knee like that, and the knees are situated my inner thigh portion like this. So we are giving the mobilization flexion like this. This is the flexion mobilization of L4, L5. After that, we switch the L3 spinous process. Come closer to the camera. We are giving the flexion mobilization between L4, L3 like this. The knees of the patient is supported by the inner groin area or inner part of the thigh. So we are also perform the using a thigh portion like this. We are not using the full range. We are using the slight range of flexion. This is the spinal flexion mobilization. After spinal flexion mobilization, we are again palpate the L5 spinous process and flex the knee like that, and knee are rest the inner portion of the thigh and giving the extension. Slightly extension. This is the extension of the lumbar spine mobilization. Switch the L5. This is the mobilization of L5, L4. Switch the L3 spinous process. This is the mobilization, extension mobilization between the L4, L3. This is the position, and after that, last we are explaining you the side flexion or side bending of the lumbar spine mobilization. We are using one hand like this, or both hand like this, both leg, and first we are using like this. Switch the iliac crest, and this is switch the L5 spinous process. This is the side bending lumbar spine mobilization. Again we switch the L4. This is the side bending lumbar mobilization. Switch the L3. Again the patient to the resting position. This is the three mobilization technique. First, flexion spine mobilization, extension spine mobilization of the lumbar, or side bending or tilting mobilization of the lumbar spine. Thank you.